There's a saying that time heals all, and I find that to be very applicable when it comes to back injuries and neck injuries, knee injury, ankle injury, where, you have a sprain, strain, and or a disc or something that seems like it could be the end of the world, and, a month later, it's not that bad. The reason I'd like to talk about this is I think people are always looking for like the one thing that got it better, and they might have it stuck in their head that like that was the thing that got them better. And we're not talking about going to the chiropractor, and we're not talking about taking some Advil. We're actually talking about, somebody might be, a month into the end of an injury, wake up one day, and then they're like, today's the day. It's changed. Today's the day. My back feels so much better. Oh man, it must have been the fact that I, didn't eat red meat yesterday, or it was because I didn't drink coffee, or it was that green celery, juice. I drank the celery juice and everything's just, peaches and cream now. I think people really need to pay attention to time, and that time heals all when it comes to these injuries. Second thing that I wanted to talk about was it's okay for your back to be the issue. And what I mean by that is, as a longtime person, as a longtime sufferer of back pain, where back pain really is the individual, single thing that from a physical standpoint, stands in the way of me progressing to do like exactly what I want to do, when I want to do it, as much as I want to do it, to the level I want to do it at. And back pain has always been the bane of my existence. A lot of us out there can relate to that. It's very common actually in, modern society, let alone all the years. Think of all the people that have labored before us and built things before us. Think about the people that have been in the most compromised positions, farmers, right? Like doing the labor and work, and they, sometimes pull on something, too hard, and, the back goes out or whatever. And as that pertains to back pain, I think it's kind of just something that nobody wants to discuss, which is that it is your back. People will say, I slept wrong. People will say, it must have been something I ate. It's driving the inflammation. Like I know people that have cleaned up a ton of their arthritic or autoimmune-like condition pains and aches that they've had. And a lot of those symptoms will go away, but then maybe their back will be like the worst it's ever been. It's not because the back and like the hand pain are even related, because in my opinion, they're not. The back is like a special, like the spine and the discs and the spinal nerve roots, and the way that nerve pain can be felt in the spine is different than the hands, the knees, and the feet. And if you don't understand why, just think of the fact that your spinal column, your actual like accessibility to expressing life in your spinal column, your brain and your spinal cord protected by your spinal column. But that's how important your spine is. That's how important getting adjusted is. That's how big of a deal spinal pain is and what it can do to you, as opposed to having some knee pain or some elbow pain or some shoulder pain or some foot pain. Not to dismiss those pains, they're real, but your spinal cord doesn't live at those levels. If you break your arm, you do not become a quadriplegic. If you break your neck, you absolutely can. So those are the kinds of issues that we have to understand when we're dealing with, discogenic related pain in our neck and our back. We're talking about the difference between not being able to use the bathroom comfortably or not being able to use the bathroom on your own. We're talking about potentially having ridiculous, vertigo and headaches and nausea. We're talking about trouble swallowing, trouble seeing. We're talking about blood vessels here, blood vessels here, blood vessels everywhere. I mean, guys, neurovascular bundles are what's behind the spinal cord. That they are the necessity of life to express to its fullest for you to function your best. And people just want to walk around and say it's your weak left glute, it's your weak adductor, it's your non-firing right glute. Or they may be an acceptable hypothesis as to why somebody is not performing to a high level, or why their stride looks a certain way. And certainly, I have plenty of friends that are running coaches, that are physical therapists, that are high-level athletes, that work with baseball players. And, it's very apparent when it comes to like the mechanics of that yes, like you're not activating your glute. You're not, there's no stimulation, your core's not braced. Breathing matters. But when it comes to like disabling back pain, where your back is out and you're walking all crooked and your back goes out and your back is a problem getting out of bed, sitting to standing, your butt hurts, your hips hurt, it takes a while to get going. Every morning your back hurts. When you're bending down, your back might have gone out. You might be like laid up for 2 weeks with your back pain. I hate to be the bearer of bad news, but you should be able to accept this. It is your back. Your back is the problem. And what I mean to say is it's not a muscle. You didn't pull a muscle. There are ligaments involved, yes, but it's a discogenic stenosis-based type problem. There is actually a limitation of matter somewhere in the spinal column. And the only two ways to fix that, in my experience, through many years as a back pain suffering patient, somebody who's had surgery that did not get the outcome that they wanted, and sees patients on a daily basis, or they themselves want to avoid surgery, and it's consistently chiropractic, being able to actually target those areas, adjust those areas, get pressure off those areas to give people the quality of life in which they seek. And that is okay, because that is what chiropractic is there for when it comes to your lower back pain. There's other things chiropractic can help with, absolutely, but that's not what this video is about. This video is about understanding that, it's not that one joint supplement that made you better. And you know what? I could be wrong. It absolutely could be the one supplement that reduces the inflammation. It could be the turmeric and ginger and the curcumin supplement. It could be the thing that reduced the inflammation enough and now you have your life back. And if that's you, I am honestly happy. I'm probably a little bit jealous, but it's also not going to be, when it comes down to the reason your back did or didn't go out, anything other than likely getting proper chiropractic, or you weren't that hurt to begin with. And then the other thing I was going to say is the diet matters a lot. It matters, number one, I still stand behind that when it comes to overall health, body composition, body physiology, but certainly when it comes down to the fundamental, issues of the back and what can help, it's time. Oftentimes, once you get the pressure off the nerves, once the body says, oh, it's okay to relax, greater range of motion, reduce pain, the body can begin to self-heal, self-regulate. That's what chiropractic does. And then you just need time. Give yourself time. Don't be the person that has to go back to the gym in 48 hours. Don't be the person that has to go back and do their most strenuous, stressful job in the next 48 hours if you just blew out a disc and you couldn't walk. I mean, these are serious issues that are deep in the tissues, and you are going to need to have a reflection. And I hope that a video like this was able to provide that for people to understand that chiropractic is a necessity when it comes to situations like we've just discussed, and time, giving yourself time to heal and understanding that that is what inevitably will heal your body is also the second point that I think people really need to begin to accept. Thanks everybody for tuning in. I hope this video brought you value and some information, insight, education. Go ahead and click the subscribe button, leave a comment below, always share with a friend who you think that this might help, and until next time, it's Dr. Pearlman.